Good afternoon and welcome to a wonderful Wednesday. We are here for our weekly read aloud, and today, Just Us and Books is at Versiti, Blood Center of Wisconsin, Versiti on King Drive location. I am excited to be here. This is where people come to donate blood, and I have the perfect book for this location. The name of our story is called Cai's ABCs of Sickle Cell. And I'm super excited about our author today because she is a 10-year-old Milwaukee native named Cai Stoudemire. She is actually the author of this book along with her mom, Richon Badger. We are going to go ahead and get right into it. What is sickle cell? Sickle cell is a genetic blood disease that causes the red blood cells to be C or sickle shaped instead of the normal donut shape. A is for acute chest syndrome. Acute chest syndrome happens when sickle cells stick together and block the flow of oxygen in tiny vessels in the lungs. B is for blood transfusion. Blood transfusions are used to boost the level of normal red blood cells versus sickled red blood cells in the body. C is for Cai, of course. I was diagnosed with sickle cell beta 0 thalassemia, and I like dogs. D is for dehydration. Dehydration can cause the red blood cells to sickle. Constantly drinking fluids can prevent this. E is for everyone. Everyone deserves love, joy, and patience. F is for fever. Fever is a telltale sign of sickness, or specifically sickle cell crisis, especially in children who can't verbalize their pain. A child sickle cell patient, like me, has to go to the ER whenever a fever of 101.5 spikes. G is for gene. Sickle cell is a genetic disease. It happens when one hemoglobin S gene is passed down from one parent as well as another abnormal hemoglobin gene from the other parent to the child. H is for hematologist. A hematologist is a doctor that specializes in blood diseases like sickle cell. They study the science of blood and or organs that create blood. I is for infection. When sickle cell, there is an increased risk of developing infections like pneumonia, bloodstream infections, meningitis, and bone infections. The immune system in sickle cell patients is not as strong as non-disease patients. J is for jaundice. Sickle cells do not live as long as normal red blood cells. They die at a faster rate than the liver can filter them out. Bilirubin from the broken down cells gets built up in the system, causing jaundice. K is for kindness. Remember to always be kind. We don't know what others are going through. L is for life. Life is precious. Live it to the fullest. M is for Merle. A bone marrow transplant can actually cure sickle cell disease. In this procedure, healthy stem cells are used to replace damaged ones. N is for newborn, blood screening test. A blood test that looks for rare and serious health conditions like sickle cell, usually conducted before the baby leaves the hospital. O is for oxygen. When normal and red blood cells, usually donut-shaped, lose oxygen, they become banana, C, or sickled shape. Hence the name sickle cell disease. P is for pain crisis. Pain crisis, also known as sickle cell crisis, happens when pain comes suddenly and can persist for hours as a result of sickle red blood cells blocking blood flow to the bones. Q is for quick. Quick response to any symptoms of sickle cell complications or crisis is so important in finding and treating the issue. R is for resilient. Anyone with sickle cell disease is resilient. We are able to withstand and recover from difficulties. S is for spleen. With sickle cell, the spleen does not operate correctly. The spleen filters bacteria from the bloodstream and produces antibodies. The sickle cells clog the blood vessels in the spleen, which lead to damage and poor protection against infection. It's common for sickle cell patients to have their spleen taken out. T is for transcranial Doppler, or TCD. A TCD is an ultrasound that screens for strokes in children with sickle cell disease. U is for unseen. Most sickle cell complications are unable to be seen. It takes tests to pinpoint exactly what's going on. V is for victorious. We, sickle cell warriors, are victorious in our fight every day. W is for world. World Sickle Cell Day is June 19th. X is for exist. Exist like there are no limitations. Sickle cell is not our limit. Y is for youth. Creating healthy habits and routines in sickle cell youth help us lead a great adult life. Z is for Zell. I, Cai, have a zeal for life and teaching others about sickle cell disease. The end. And I wanted to make sure you saw a picture of Cai and her mom. There she is. Cai, it was an absolute honor to read your book, Cai's ABCs of Sickle Cell. I do hope you enjoyed our read aloud for today and also learned a little bit about sickle cell disease. Just us and books.